Welcome to Vertical Movement PT. I'm Dr. Cindy Kimmi, physical therapist. I know everyone at some point in their life, they've had a tension headache. So today we are going to do a routine to help get rid of those nasty tension headaches. So go ahead, find a comfy spot, and let's get started. What is a tension headache? A tension headache is when you have pain in a band-like pattern on your forehead, your scalp, and your neck. Tension headaches, they're caused from when you're going through a lot of stress, muscle tension, poor posture, and lack of sleep. So today in this routine, we're gonna learn a few exercises and stretches to help reduce that muscle tension. Also, we're gonna learn strengthening exercises to improve our posture. We are going to start off doing the soft tissue mobilization portion of this routine. What you're going to need to get is 2 tennis balls and a long sock. You're gonna put the 2 tennis balls in the sock and tie a knot at the end, really making sure that the knot is close enough to the tennis balls that if you try pulling them apart, they cannot pull apart. Also, if you have a foam roller, go ahead and grab that. And if you don't, I highly recommend purchasing one because foam rollers are great to release tension throughout your whole body, your legs, lower back, upper back, glutes, hips, neck, pretty much everything. So I highly recommend purchasing one. So what we're gonna do with the tennis balls, we're gonna use it to release the suboccipital muscles. And the suboccipital muscles, they're placed at the base of your head, right over here, and they're consisted of 4 different muscles. The rectus capitis posterior minor is the closest to the spine. The rectus capitis posterior major is a little bit outside of that muscle. Then on the side, we have the obliquus capitis superior and obliquus capitis inferior. So those 4 muscles are on each side of the spine, and we're gonna place the ball right on top of them. So right here is the bumpy part of your scalp. You're gonna place the tennis balls right underneath that on top of the muscles. And we're gonna do that by laying down on the tennis balls. So find a nice firm surface, nothing too soft. And highly recommend not doing this on a bed or a soft surface. So you're gonna place tennis balls right in that spot. Make sure your knees are bent. The reasoning for that is to help support your low back because when your legs are flat, your back tends to arch up. If you bend your knees, it helps relieve the low back pressure. And what you're gonna do once the tennis balls are placed on the suboccipital muscles, you're gonna go ahead and rotate your head to the left and to the right. And what you're gonna find is some spots are gonna be a little bit more sore than others. And when you find that sore spot, you can go ahead and stop and let the tennis balls sink in that area. You can go ahead and do this for about 1 minute to 5 minutes, as long as you think you need it for. You could also do some chin tucks, and that helps work the fibers in a different direction. If you have that sore spot, you can just go ahead and hold it there again. But for some people, the tennis balls, they do not work as well, and some people prefer using a foam roller. So if you have that, go ahead and grab it. If you don't, go ahead and continue to roll out with the tennis balls. But you're gonna place the foam roller right at the base of your head, and what you're gonna do is the same thing. You're gonna go ahead and rotate from left to right, really kneading out those muscles. You could also do the chin tucks up and down. For me, I really like the foam roller if I'm trying to get a larger surface area and trying to get more of the muscles in the back of my neck. The tennis balls, it has more of a higher force because it's a smaller surface area. So if you're looking for something with a little bit more, well, band and power, I would recommend the tennis balls. Okay, So right now you can go ahead and pause the video if you want to continue to roll out with a foam roller or a tennis ball, and then go ahead and start the video when you're ready. Next, we're going to go ahead and start our stretching portion of our routine. Our first stretch we're going to do is the upper trapezius stretch. We're going to start off stretching the left side. So go ahead and with your right hand, place it over your head, left hand behind your back, and you're going to gently go ahead and pull your head to the right, and that's going to stretch the left upper trapezius. If that stretch is a little bit too much for you, you can go ahead and take your hand off and just let your head hang there. And if you can add a nice and light / gentle little extra pull from your right hand. And you don't want to be too aggressive, or really not aggressive at all. Okay, let's go ahead and switch to the other side. Left hand over your head, right hand behind your back. And very gently, you're going to bring your head to the left. You're going to feel a nice pull on the right side of your upper trapezius. And if that's too much, you can go ahead and drop your hand down. Or you can even drop down the right hand. You have options. Next, let's go ahead and move on to the Levator scapular stretch. So right hand on top of your head, left hand behind your back. We're going to stretch out the left Levator scapular muscle. And you're going to go ahead and look down at your armpit. And very gently bringing your head down closer to your armpit for a nice little extra stretch. You can go ahead and even add some diaphragmatic breathing through your diaphragm right over here. Okay, let's go ahead and switch to the other side. So go ahead and bring your right hand behind your back, your left hand on top of your head, and go ahead and look at your left armpit. And very gently go ahead and add a nice little gentle pull. Doing some diaphragmatic breathing. Just a reminder, none of these stretches should be painful. If you're having pain when you're pulling too hard, or maybe you're just not ready for that stretch quite yet. And let's go ahead and move on to the Sternocleidomastoid stretch. And the short way of saying that is SCM stretch. So we're going to start off with the left side here. Left hand behind your back, and with your head, you're going to tilt it the opposite direction to the right. And the tricky part is you're going to rotate your head to the left. You're going to feel the pull right along the side here, your sternocleidomastoid. It attaches here to your sternum and right over here to your mastoid. You can go ahead and have your hand add an extra little stretch if you want that extra pull. Okay. Let's go ahead and switch to the other side. We're going to stretch the right sternocleidomastoid. So go ahead, right hand behind your back, tilt your head to the left, and rotate it to the right. And you can add your left hand if you want a little extra stretch. So this muscle is great to stretch out because when this muscle is tight, it's really hard to bring your head back and to have it aligned with your shoulders. And when our head is forward, you can go ahead and take a break. When our head is forward, that's what causes the tension headaches, the pressure in the back of your head. Okay, next we're going to go ahead and do the suboccipital stretch. And that's going to stretch out the suboccipital muscles back here. Go ahead and place your hands right here underneath the bump on the back of your head. And very gently, you're going to bring your head down so you feel a nice stretch in the back of your neck and the base of your skull. It should work similar to just like this. You should feel the pull right there. So you're pretty much pulling your head up and down. Up and down. And next, we're gonna go ahead and end with our last stretch, and that's to stretch out our pec muscles. You're gonna put your hand on the back of your head, and you want your elbows to be more in a Y. You're gonna go ahead and look straight up at the ceiling. You should feel a wonderful stretch in your chest. If the stretch is a little too much for you, you can put your arms a little bit lower. Try to get it up a little bit higher if you can. Alright, so that's the end of our stretching routine. Next, we're going to go ahead and move on to our strengthening portion. Our first exercise is diaphragmatic breathing. So you're going to go ahead and place your hands right on our diaphragm, which is underneath the rib cage. And you can do this sitting, or you can do this laying down on the ground. Go ahead and you're going to focus on breathing into your belly right where your hand is, and not breathing with your chest or using your neck muscles. A lot of the times, because we have bad posture, we breathe with our neck muscles. So what we need to do is to learn to breathe with our diaphragm, so that way our neck won't get overused, and then we won't get the tension headaches. So hand on our diaphragm, and you're gonna go ahead and breathe in and out. In and out. Relax your shoulders. Breathe in and out. Breathe in and out. Breathe in. Two more. Breathe in and out. And last one. Breathe in, hold it, and out. That made my tummy grumble a little bit. It's almost dinner time. Next, we're gonna go ahead and lay down on the mat, and we're gonna work our core. Core is so important. Having a strong core is so important, and having posture that is upright and supported. And we want to have a strong core and an upright posture so that our head won't be falling forward, and then we'll get the tension in our neck, which causes our headaches. So let's go ahead, and with your hands straight up, we're going to do a dead bug. So bring your feet up into a tabletop position, and you're going to go ahead and tap away, nice and slow, making sure your core, your transverse abdominis muscle, is nice and engaged. You want to make sure your low back is not lifting up off of the ground. If this is too hard for you and you are experiencing low back pain, you can start off with your feet on the ground, and you can bring your leg up one at a time. But if you can handle the dead bug position without straining your low back, go ahead and go for it. You can go ahead and try to activate your diaphragm at the same time, breathing through your diaphragm. Also, you want to activate your pelvic floor muscles, and those are the muscles that line your pelvis. To activate those muscles, it's vulgar, but pretend like you're peeing and you're trying to stop the stream of pee. I think you get the point of how to activate those muscles. But having your pelvic floor muscles engaged, your core engaged, and breathing with your diaphragm is the most efficient way to do things safely, really, to protect your back and to help with your posture. Okay, let's go ahead and move on to our scapular squeezes. So you can do this sitting, or you can do this standing up. And what you're gonna do, you're gonna go ahead and squeeze your shoulder blades together and relax. So this exercise helps strengthen our mid-scapular muscles. And those muscles are important to help keep our shoulders back. And that's important for the same reasoning of why we need a strong core, to help prevent us from having a rounded posture and to prevent our heads from falling forward. And yes, you guessed it. Yes, you guessed it. It causes the tension headaches when our heads are bobbling forward. Okay, go ahead and do 3 more. And last one. Very good. Next, we're gonna go ahead and do chin tucks, and that's important to help work our deep neck flexors, these muscles right here. And these muscles help so that we can keep our head back and our ears aligned with our shoulder so that we're not straining our muscles back here and not straining the suboccipital muscles. When our head is forward like this, it actually pinches, or it causes, a pinch of our greater occipital nerve, and that runs back here. And that causes our headaches when that nerve is being pinched. So if we can have our head nice and aligned, you can actually prevent a lot of headaches. So you're gonna go ahead, bring your head back, and relax. And back, holding it for a few seconds, and relax. And back, 1, 2, 3, and relax. You might feel like your neck's getting a little bit tired in the front, and that means you're working the right muscles. And relax. Make sure to keep your shoulders back. And relax. So you've got 4 more. 1, 2, 3. Relax. And back. 1, 2, 3. Relax. Back. 1, 2, 3. And relax. Last one. 1, 2, 3. And relax. Okay, awesome. Let's go ahead and move on to round 2. We're gonna go ahead and go down onto the mat. And this time I'm gonna show you the diaphragm breathing while laying down, so you have your options. So knees bent, hand right on your diaphragm, underneath your ribcage, and go ahead and relax your shoulders. Okay, now go ahead and breathe into your belly. Deep breath in and out. Make sure your chin is down so your head isn't arched back. Deep breath in and out. In and out. In and out. Make sure you're not breathing through your chest but through your belly. In and out. A few more. Breathe in and out. Breathe in and out. 2 more. Breathe in and out. Last one. Breathe in and out. Good job. Let's go ahead and move on to the dead bugs. So bring your feet up to tabletop, arms up, and let's go ahead and get tapping. And like I said, if this is too hard on your lower back and you're not quite ready for this, you can put your feet down and lift up your legs into tabletop. Okay, so that's your option. But if you can handle it, go ahead and tap away with your core nice and tight. If you want a little bit more of a challenge, you can go ahead and add some arms. Just make sure you're not compensating and arching your back. You want to make sure the core is activated and your core stable. You never want to compromise form. Okay, let's go ahead and do
one more each. And voila. All right, go ahead and let's sit up. And let's start off with our shoulder scap squeezes. Very nice. You can go ahead and do the standing also, if that's more comfy for you, or sitting in a chair. Squeezing those shoulder blades, making sure your shoulder is nice and relaxed. You want to make sure you're not elevating up like this, because that's working the wrong muscles, and that's actually encouraging the muscles that's causing your tension headache to activate again. Uh-oh, we don't want that. So relax the shoulders and squeeze the shoulder blades back. Okay, let's do 2 more. 1 and 2. Okay, let's go ahead and finish off with chin tucks. You're gonna go ahead, tuck your chin, hold it for 1, 2, 3, and then relax. And just make sure your shoulders are back. Your head's aligned. Ears are aligned with your shoulders. Ears are aligned with your shoulders. Hold it. 1, 2, 3. Relax. Again. 1, 2, 3. And relax. Ooh. My neck's getting up a little bit tired. That's good. 1, 2, 3. Relax. 1, 2, 3. Relax. I also call this exercise double chin exercise. Completely flattering, I know. And again. 1, 2, 3. Chin tucks are great to help stretch out those suboccipital muscles. I know for my husband, he loves this one. Relax. Because whenever he feels like he's getting a headache, he just chin tucks, stretches, and his headache goes away. Okay, and last one. 1, 2, and 3. Fini. Good job, everyone. I'm so proud of you for taking the initiative of doing this routine. I highly encourage doing this routine 2 to 3 times a week, especially if you work a desk job or if you're sitting often. Okay, I'm so glad that you were here with me today. I hope you have a great week. See you later. Peace.